My dinner may consist of hot dog and macaroni and cheese. Primarily because it's the easiest thing for my sister to buy for me, and because it's one of the few things I know how to make.
Yesterday I went outside for the first time in a year. It was terrifying. The UPS guy came and left the package on the front porch. Didn't even have the respect to hand me it.
I've been like this for probably my whole life. It's hard to make friends when everyone's so mean nowadays. I wish I could just go outside and meet everyone I talk to, but I can't. I just can't.
My name is Robbie Wingard, and I have agoraphobia.
My name is Patrick Stilsky, and I also have agoraphobia.
Agoraphobia is an irrational fear of places that might cause panic, helplessness, or embarrassment. Most of the outside world would fall into this category, so agoraphobic patients hardly leave their house. This is a pretty common psychological disorder with 200,000 to 3 million cases in the U.S. alone. Agoraphobia can be treated using a variety of therapy techniques. Some you'll see in this film.
Robbie's one of my favorite clients. I mean, he's nice, he's funny. He made me some mean tacos a couple weeks ago. However, I've been seeing him for 3 weeks now, and I don't think I've seen any progress in him. This week, I think I'm going to try something new.
I'm agoraphobic, or at least that's what my therapist tells me. Dr. Sachs is a nice guy. I like him. He's kind of weird, though. Made him some tacos a couple weeks ago, and now he won't stop talking about them. Really do think he's trying to help. I just don't think there's any cure for me.
Hey, Rob.
Hey there, Dr. Sachs.
How are you today?
Good, good. Take a seat.
Let me just pull out my notes real quick. Have you gone outside at all this past week?
I haven't.
Well, yeah, that's okay. I know you've been feeling fine, and you've agreed to help me help you, which a lot of people don't do. They like to deny their fears, so that's a good first step. But you have this strong fear of the outside public world, and I just haven't seen any strides in you overcoming this fear. And well, it's been 3 weeks, and I still have to drive to your house every day instead of you coming to my office. So I think this week we should try something new.
All right, let's hear it.
3 words: cognitive behavioral therapy.
Cognitive behavioral therapy is a psychotherapy that involves a mixture of many procedures, including cognitive structuring, stress inoculation training, problem solving, skills training, and relaxation.
I like it. How long is this going to take?
To be honest, I don't know. Therapy like this usually lasts about 12 to 15 weekly sessions, each session lasting about an hour. Hopefully we'll see rapid improvement in you, and it won't have to take that long.
Alright, well, when are we going to get started?
Well, as soon as today. How's that sound?
Sounds perfect. What do I think about my agoraphobia? I don't really know. I don't like talking about it. I've never really been good with people. Guess it all started in 2nd grade, the first day of school. As I was walking into the building, a giant bird dropped its mother load on me. I remember it like it was yesterday. All the kids were laughing at me, and I ran home crying, demanding to be homeschooled for the rest of my life. I never wanted to see them again, or anyone for that matter. I guess you could say that's what triggered my so-called agoraphobia. All I know is it's flippin' impossible to go outside, and I need Dr. Sachs to help me.
Lucas and Robbie have a productive first session of cognitive behavioral therapy. Meanwhile, Patrick, another agoraphobic patient of Lucas's, is waiting for his therapist to arrive.
I know what agoraphobia is. I know all about it. I don't have a job or anything, so I spend my days reading online articles about this disorder. Every article I read, though, I just can't seem to find a cure. I suffer from panic attacks, too. When I'm walking down the street, even when a stranger says hi to me, I still run away screaming. I haven't seen Dr. Sachs in that long, but I trust he can help me.
Patrick is a pretty unique case. He, unlike Robbie, who has that one defining moment, I feel like this has been building up in Patrick for a while. You know, he's a nice kid and all. I mean, he surely would have made friends in grade school if he just didn't sit in the corner on the playground every day. I feel like his problem is more physiological than psychological. I think I'm gonna try out drug therapy on him.
Drug therapy, also called pharmacotherapy, is one of the fastest growing psychotherapy techniques, with new advances occurring every year. It views every psychological disorder as having a physiological root to it, usually a chemical imbalance in the brain. If a therapist can identify what's going wrong with the brain, then he or she can prescribe a certain drug to fix the problem and cure the disorder.
Patrick, how are you doing on this fine afternoon?
I'm good. I'm good.
May I come in?
Yes, you may.
Have you gone outside at all this past week?
Well,
No? You know what, that's fine. I can see you're still making progress. You'll get around to it. Hey, I actually, I got this for you.
what's that?
It says Ativan. It's an anti-anxiety drug. Help you loosen up.
Will help my disorder?
Of course, that's why I got it for you. Take that twice a day for the next 3 weeks, and we'll see how it goes. I'll be coming back weekly, too, to monitor your progress and still chat with you.
Okay, sounds cool.
Ativan is not the solution to Patrick's agoraphobia. I gave him a prescription for 3 weeks so he doesn't get addicted to it. Now that he is taking Ativan, however, you know, he'll be more open to the outside world, which is where I will come in and hopefully expose him to this and hopefully eliminate his fears.
You know, these drugs that Dr. Sachs gave me, they make me feel good, like really, really good.
It's been a month since Dr. Sachs has started the cognitive behavioral therapy on me. I know he said it would be a long process and all, but I'm getting kind of worried. I'm still terrified of going outdoors.
So Robbie, I know it's going to be hard to talk about, but this needs to come up. That incident, does it still scare you?
Are you kidding me, man? That's all I ever think about. Every time I close my eyes, I just imagine the birds pooping on me and everybody laughing. Their sneers and smirks are seared into my memory forever.
Well, I mean, kids are vicious nowadays. I'm sure they've forgotten about it by now.
Yeah, I doubt it.
Alright, you know, let's say they haven't forgotten about it. Why don't you just go to a different school?
You don't get it, Dr. Sachs. Every time I go outside, I get this feeling of helplessness. And whenever this helpless feeling comes, I get panic attacks. I'm afraid they're going to kill me soon.
Alright, that's absurd. A panic attack will not kill you. Sure, it's uncomfortable, but it's only temporary. Next time you have one, just tell yourself, you know, it'll be okay. It'll all be over soon. This won't kill me. I'll be okay.
Yeah, so I'll just walk to the grocery store and have 10 panic attacks. Is that what you want?
Of course not. Of course not. I'm just saying, telling yourself that, you know, it'll all be okay, that's the cognitive part. That's me molding with your brain, like I said earlier. Now we need to work on some behavioral therapy to actually eliminate your fears.
Okay, so what are we going to do?
Then we're going to try systematic desensitization.
Systematic desensitization is an exposure therapy technique commonly used to treat phobias. Instead of flooding their patient with their fears, this method works to take steps towards ultimately defeating the phobia. 1 week, Robbie will be able to walk to the end of his street. The next, Robbie will take a walk around the block. In a couple more weeks, Robbie should be able to try and walk into the local drugstore. By the end of training, he should be able to go into a giant supermarket or take a walk into downtown.
You can do this, Robbie. Just go down to the end of the driveway, get the mail, and come back. I know you can do this. Good. Good. That's good. Good. Keep going. Keep going. That's good. You can do this. You can do this. Keep going, Rob. Good. Good. Other than that lady sneaking up behind Robbie, I'd say he made some progress today. He made it all the way to the mailbox without having a panic attack. I'm pretty proud of him for that.
After starting systematic desensitization, Robbie starts to make great strides towards curing his disorder. After the first month, he was able to successfully get the mail without having a panic attack. After 3 months, he was able to walk into the local drugstore and pick up the small things for the house. It is now 6 months after starting Lucas's exposure therapy system, and Robbie just brought groceries for the first time in his life. Lucas was there to support him the whole way.
Wow, Robbie. I was really impressed with you out there. You really handled yourself well.
I'm impressed too, Dr. Sachs. I think your therapy is really working.
Thanks, Rob. It means a lot. 7 months ago, I came over here for the first time. You were curled up in a ball right there. Too scared to even talk to me in your own home. Now look at you. You just made small talk with a grocery clerk. Like a normal human being. So proud of you.
Thanks, Dr. Sachs.
Robbie continues to make improvements. In the fall, he starts attending the local high school. He still meets with Dr. Sachs weekly. Meanwhile, Patrick has almost fully diminished his fear of the outside world as well.
I've been off Ativan for about 2 weeks now. When I first started taking it, Dr. Sachs exposed me to the real world. And I realized there's nothing to be afraid of. Now I can go outside without Ativan. And I love myself.
And I love myself. The world is a ghetto with big guns and dick inside. I love myself.